Hello, Dr. Vicki Peterson here. I wanted to talk to you today about a fascinating lecture I listened to last week by Dr. Alessio Fasano. He was interviewed by Dr. Tom O'Brien. If any of you had the pleasure to listen to the first Gluten E-Summit, this particular conversation was part of that. And there were some very interesting points that I wanted to review just because they can't be reviewed often enough until we have a change in our awareness and in how we treat certain diseases and our approach to gluten, etc. So let's just go over some common myths that Dr. Fasano very eloquently dispelled. One is something you hear all the time: how could wheat be bad for me? It's been around forever. So what he points out is the fact that for 99.9% of our evolution, there has been no wheat involved. So we didn't evolve to digest this grain. And the facts are that because of its amino acid components and the sequencing of two amino acids, proline and glutamine, this is a protein, gluten is a protein that is indigestible for humans. Now, not just people with celiac disease, not just people with gluten sensitivity, but for humans, it is indigestible. Now, Dr. Fasano goes on to say that for 70 to 80% of the population, it's still indigestible, but their immune system doesn't wreak havoc on the body when somebody ingests it. However, that means for 20 to 30% of the population, havoc is wrecked. And what was interesting about that is I've always said that I felt the gluten sensitive population was probably in the range of 30%, and this is the first time I heard Dr. Fasano go as high as that. So that was nice to hear, because I completely agree, and that's certainly what I see in my practice. The other thing he talked about quite a bit was autoimmune disease, which this is an area that really needs a lot of work, because autoimmune disease is terrifically on the rise. He actually calls it an epidemic in this particular discussion, and he says it's an epidemic that's been coming onto the scene for about 40 to 50 years. Currently, there's over 100 different autoimmune diseases. They together as a whole rank the third leading cause of death in our country, and literally every time we look at their incidence, it keeps rising. So this is something we really need to look at, and the way the traditional method of treating autoimmune disease is to just say we have no idea what causes it, there's no cure, and here's what we're going to give you, Mrs. Patient, which is a dangerous immunosuppressive drug. So you suppress your immune system, what's going to happen? You're more likely to get sick. You're already sick with autoimmune disease, now you're more likely to get cancer and various other problems. So not the best approach. I've never thought it was a great approach, but Dr. Fasano has been doing a tremendous amount of research, and he made some wonderful statements, which was that really autoimmune disease begins in the gut, which isn't that big a stretch if you come to grips with the fact that 70 to 80% of our immune system is housed in our gut. So it really does make sense that it begins there. But what he says is that autoimmune disease could be arrested if we increase the health of the gut. Because once again, that's where the immune system is housed, and it's just not the way we go about it. We go about this treatment, as I mentioned, with the immunosuppressive drugs in a very dangerous way, because this is a system that needs supporting and nurturing and strengthening the immune system. The last thing it needs is a drug that's going to completely annihilate it, right? So this is something that, you know, these autoimmune diseases, as I said, are so on the rise. There is some research that wants to include heart disease as part of autoimmune disease. So that would make it obviously the #1 killer in our country, because heart disease is the #1 killer. So regardless if it's 1 or 3, the facts are it's very much impacting our health. It's doing it on an increasing basis, and it's something we really have to address. So what I thought was also interesting is that in addition to autoimmune disease coming from an unhealthy gut or a leaky gut, Dr. Fasano also included stroke, heart disease, Alzheimer's, which is an autoimmune disease, allergies. What else did he include? Oh, inflammation, which is, we now know inflammation is the beginning of all degenerative disease and cancer, if I didn't say that earlier. So he took all of those diseases and conditions and put them in the category of being caused by a leaky gut. So looks like we really need to heal our leaky guts, right? And that's what I love to do. So when we're looking at this, we just can't think that what we eat doesn't matter. And putting gluten to the side for a moment, okay, so you already know you're intolerant to gluten and you don't eat it. Great, very smart first step, very critical first step. But what else do you eat? You know, do you get your 9 servings of fruits and vegetables? Are you getting your essential fatty acids in the form of fish oil or nuts and great oils? Are you eating a lot of, on the other end of the spectrum, are you eating a lot of fast food and junk food and highly processed food? Are you avoiding GMO, or do you, not really put that into your lexicon of how to eat, and you're not looking for organic, and so there's a lot of GMO foods coming into your system, which is definitely altering the permeability of your gut and making your immune system weak. So there's a lot here that really needs to be looked at, and we really need to do it quickly in order to turn around this epidemic, as Dr. Fasano called it, of autoimmune disease. One other last point that he made that I thought was very interesting was that the facts are that so many gastroenterologists and so many doctors in our country feel that a gluten problem is a gut problem. And certainly when you eat, the first place food goes is your gut, so fair enough. However, for a good percentage of that population, and if you're somebody who suffers with depression and doesn't have any GI problems, or has skin conditions and doesn't have any GI problems, or has fibromyalgia or joint pain or fatigue and doesn't have any GI problems, you know, and you're gluten sensitive, of course, you understand this concept that trying to put gluten into a box of just GI problems only is ridiculous, and he says reductive, meaning taking it down to this fine point or fine little box that it just doesn't fit in, because gluten can affect so many different systems of the body. So if your doctor's telling you that, feel free to enlighten them, please. That's what we need. So I bring this up just because we are in a model of autoimmune disease. We are in a model of gluten that's just wrong. And so Dr. Fasano's research shows that it's wrong. A number of other individuals around the world are researching and shows that it's wrong. Certainly my clinical experience shows that it's wrong. So I'm just going to keep talking about it until a change occurs. In the interim, I want to tell you we have a lot of tools that can heal a leaky gut, a lot of things that you look for over and above eliminating gluten, and that's the most common thing I see and I hear from you watching, listening, etc., is that, gee, I'm off gluten, but I'm still not feeling better, or I'm feeling better, but I'm not feeling as good as I want to feel. And that's extremely common because of the leaky gut. So there's nutritional reasons, there's infection reasons, there's imbalance of the probiotics, or the microbiome, the good bacteria of the gut that are so vitally important. There's abuse of antibiotics, there's, the poor diet. So there's a bit of a list. It's not a list that's, yay long, maybe 8 different items that we in our clinic look at and see, which things fit into the box that's creating your problem and which don't. But these are not hard things to deal with. So we can really repair that immune system and repair that leaky gut and either reverse early autoimmune disease, halt current autoimmune disease, or so reverse, halt, or maybe just prevent future autoimmune disease, because as soon as you have one, you're much, much more likely to get others. So whatever happens, it's still positive. Certainly we can't guarantee that we're going to reverse all autoimmune disease. That's not possible. But halting, sometimes reversing because you're catching it early enough, or at least preventing a worsening of health, these are things we do, and it's very available. So if your health is not as good as you want it to be, definitely feel free to contact me, give me a call. That's what I'm here for. And I hope you found this informative. Until next time, I wish you very good health.